Sedatives and tranquilizers are commonly used in veterinary medicine to produce calmness, for chemical restraint, and as an adjunct with general anesthesia. Drugs that produce sedation often have different mechanisms of action, pharmacodynamic effects, analgesic properties, reversibility, and physiological effects. It is therefore important to understand the different classes of sedative available to be able to predict wanted effects and potential side effects. Sedatives and tranquilizers are also used to promote sleep but not necessarily inducing sleep. Hypnotics, on the other hand, is a drug used to induce sleep. Basically, they have two classifications. The first classification is the tranquilizer sedative group, such as phenothiazine derivatives, butyraphenone derivatives, and benzodiazepine. Another classification is the sedative hypnotic group, such as barbiturates, chloral hydrate, and xylazine. Phenothiazines were originally developed and used as antipsychotic drugs for the treatment of schizophrenia in people. However, they have been used in veterinary medicines as tranquilizers. So, it has a physiological effect such as the depression of the reticular activation system in the brainstem and thus the blockade of the central excitatory dopaminergic pathway. It blocks the peripheral alpha-adrenergic receptors in vasculature. It has mild effects upon respiratory activity, and it provides good muscle relaxation. There are various examples of phenothiazine. The first one is azepromazine, which is the most commonly used phenothiazine in the veterinary medicine. It is extremely potent and the duration of action is dose-dependent. Another one is chlorpromazine, where it is less commonly used as a pre-anesthetic sedative. Promazine, methyltrimiprazine, promethazine, and propionylpromazine. You have to take note that any phenothiazine tranquilizer may cause some degree of penile paralysis in horses.
Hi, I am Ella and I am going to report about butyrophenone derivatives. Butyrophenones in the late 1950s were introduced into human medicine as antipsychotics. They are less frequently used for anesthetic management of domestic veterinary patients but are increasingly used in zoo and wildlife settings. For the classification, they are neuroleptic sedatives and still one of the major classes of antipsychotic drugs used in human medicine. Similar with the phenothiazine tranquilizers, butyrophenones block the excitatory central dopaminergic pathway as their mechanism of action. Examples of butyrophenone are haloperidol, droperidol, and azapirone. Among the three examples, azapirone is commonly used in the veterinary field. Presented are its synonyms, systematic chemical name, its molecular weight, and molecular formula. The effects of azapirone when administered last for 2 to 3 hours, which is suitable for pigs, however, causes violent excitement in horses. Its respiratory effects are minimal, and it appears to antagonize the respiratory depressant action of anesthetic drugs. A sow during farrowing when administered with azapirone will not affect the born piglets. They may appear sleepy for some time after delivery but will do well if kept warm. In addition, a chaperone may be used to mitigate anxiety of any cause in the pig pen.
Benzodiazepine is a sedative hypnotic that causes anxiolysis, sedation, and ability to cause sleep. The substitution of halogen or nityl group at the 7th position of its structures gives it hypnotic sedative properties. Benzodiazepine do not produce analgesia and it's not a general neuronal depressant. The surgery using benzodiazepine cannot be achieved since it allows enough relaxation and awareness persists. It is commonly combined with other agents such as opioids to provide more predictable sedation. The behavioral effects using benzodiazepines in the healthy patients are mild, and the sedation effect is more reliable in neonates, geriatrics, or ill patients. The chlordioxyperoxide is the first benzodiazepine introduced. It has an taming effect when given orally to a certain wild animals including ungulates and large felidae. Diazepam is a highly lipid-soluble benzodiazepine that has anticonvulsant, sedative, hypnotic, and tranquilizing effect that causes pain when administered intravenously or intramuscular. Diazepam used as induction, synergistic adjunct to propofol, ketamine, or etomidate. Midazolam is a water-soluble benzodiazepine. Its chemical structure produces both water and lipid solubility based on pH. Midazolam is more potent than diazepam that can be administered in a variety of routes that does not cause pain on injection. Midazolam is more commonly used in a veterinary medicine cause has a lower cost than diazepam. Lorazepam is a drug of choice for a state epilepticus in human. Its therapeutic level achieves when administered intravenously. Injectable lorazepam is supplied in propylene glycol that causes pain on administration. Lorazepam is uncommonly used as a sedative or anticonvulsant. Lorazepam is a water-soluble benzodiazepine but at acid and physiological pH. It is only available as part of the mixture of telazol.
Hi guys! I'm Crisanna James Soriano of Group 6 and I'll be reporting about sedative hypnotic. Sedative hypnotic. Drugs of this class causes a dose-dependent spectrum of CNS depression, sedation, sleep, anesthesia, coma, and death. Barbiturates is a drug derived from barbituric acid were shown to produce sleep and prevent seizures. Barbiturates is a CNS depressant and is used at increasing doses to produce sedation, hypnosis, anesthesia, coma, and even death. Its major uses in veterinary medicine are as induction agents for anesthesia, anticonvulsants, and euthanasia agents. Next is chloral hydrate. Chloral hydrate is a non-barbiturate, white translucent, crystalline with pungent melon-like smell. It is soluble in water and decomposes in the presence of alkali. Chloral hydrate is a general sedation and is adjunct to anesthesia primarily in horses and cattle. Its clinical uses and dosage for sedative effect is to administer as drench or as bolus in drinking water for 18 to 48 hours water deprivation or by stomach tube. For basal narcosis, it is given orally by stomach tube after starvation or by IV using 7% solution. For anesthesia, it is administered by IV only to horses and cattle.
Hi, my name is Erica Jane L. Zabate, and today I'm going to tackle about the next drug, which is xylazine. Xylazine is a clonidine analog. It is used primarily for sedation, anesthesia, analgesia, and muscle relaxation, but it has other pharmacological effects. Most of these effects consist of the bradycardia and hypotension. Xylazine inhibits the effects of postganglionic nerve stimulation. Cattle are particularly sensitive to the effects of xylazine and require a much reduced dose compared with other species and approximately 1/10 the dose compared with horses. The dose rate of the alpha-2 adrenergic agonist in cattle is similar to other species. Conversely, swine require 2 to 3 times the dose of xylazine compared to the dog, cat, or horse. Here we have the chemical name of xylazine, and here we have the chemical structure or the structural formula of xylazine. We also have here the molecular formula and also the molecular weight.